I think they just need reinforcement on some and course correction perhaps on others. So I'm glad there is general consensus. Mohit, I'll come to you because I mean, at the end of the day, you do work with a very large organization, um, right? It is a very large organization, and it's global, right? And I mean, in the next part of this conversation, I want to talk a little bit about what that means to be global and some of that harmonization. But from your perspective, also just on how do teams collaborate in a global organization where there are different, I mean, you do have your own set of inclusive design principles at Microsoft, right? But I'm sure they're interpreted in different ways in different parts of the world, or not. I mean, I'd love to understand a little bit of that perspective on in a large global organization. But how do you see that guidance? How do you adapt them to the context you're working in? Any reflections on that, or has it been smooth sailing? In which case, maybe this question is moot.
Yeah, definitely not smooth sailing. I think I think at the core of most of these responsible AI, I think the principle or like is that like we should. It's about preventing any kind of harm from AI. I think that's sort of like the simplest way to put it. I think the other, I think um, the way I think we have been interpreting it more broadly in India specifically. Again, it's hard to say because I think every team is, I think most of these are written or prescribed in a manner that it is open to interpretation. So I think in India, or at least in the research lab, the way we are doing it is that like apart from responsible AI, that like it should definitely not do any kind of harm. I think the other way is also to make it like very inclusive AI. So this sort of like taking it hand in hand, like the benefits of the AI should not be limited to a certain uh, demography, be it like social or economical, like yeah, it should not be limited to that. And hence there is a like wide variety of projects that have been focusing on different domains, but that also like across the demography chain as well. So like in education or healthcare or accessibility or agriculture, so that it's not only like a certain sector, but across it. So I think so those are, I would say, the broad interpretation I can point to. Yeah. Thank you.
Just maybe following up on
Sure.
that, there's also across the world there are different. Let's just take for example data protection as a legal framework.
Yeah, yeah.
They differ so widely.
So widely, yes, yes.
And how do you factor that in? Like, is it? Because I can get away with a lot more in India, I do it, or
No.
I set a
So
global
Microsoft policy is very, very clear there. Again, so I work a lot with the. So Microsoft has a division called as CELA, CELA, which is the legal entity inside Microsoft. So you need to get their approval for any kind of critical deployments or anywhere where like human is involved. So any kind of human factors, human evaluation, or even or like I work in healthcare, so a lot of, and even with people with disability. So you have to go through the CELA process, and the way they work is that they take the worst case scenario from the two entities. So they have to like it's US because most of these CELA people are living in US, and then they have like a body in India. So based on like the laws in US and in India, they try to take the harshest one possible basically. Okay, so before let's say like DPDP was not there, then the GDPR equivalent of what was there in US that was being followed. But now like now DPDP is there, so they learn about DPDP and GDPR and whatever like equivalent there in other markets. They say like okay, out of this combination, which is like the common things are taken, but like if there are like two things which are conflicting, the harshest one is taken and applied so that they are doing justice to it. Yeah.
Thanks. I was curious personally about that one, so I'm glad I got that answered. Tess, for you, I know there's a lot of work that the UK has been doing to drive AI assurance. If you could help unpack what that means for this room, and also some insights on how companies are actually approaching building AI tools that are fit for purpose, especially to include vulnerable communities, right? So if you could reflect on that for us.
Happy to. AI assurance is my absolute favorite thing. It is the means, or how DCIT really defines it. Our government is about how we evaluate, measure, and communicate ways that we mitigate risks in emerging tech, in this case AI. Another way to understand it is regulation kind of talks about what is responsible AI. And AI assurance is how we actually do that. So for instance, we might hold the principle of transparency, the ethical principle, and that sounds really nice, but in order to do that, we do the assurance technique or tool of a system model card, which is like a nutrition label, but for the system, right? And within the UK context, it's a real economic and policy priority for us. In a DCIT report called Reassuring the Future of Responsible AI, this space actually already employs 12,000 folks. It's been quoted worth 1.6 billion and set to grow 6 times over the next decade if we address barriers to this space. So, you know, that then was followed by something called the Trusted Third Party Roadmap. And in this, there was 4 key areas that our government is focusing on, and I think, you know, assurance in other areas should as well. It's a challenge for responsible AI practitioners, AI auditors, folks that are trying to stress test these systems, information and data access, the skills and competency framework for that profession itself, and actually money towards innovation and novel approaches of assurance. And then DCIT is also getting together something called a consortium. So they're taking together folks that are the responsible AI lead at Microsoft or other larger companies and smaller companies as well. And they're kind of bringing them together. In terms of my research itself, and the UK is taking a sector-specific regulatory approach, and that, as our AI assurance ecosystem is maturing, is getting echoed. So we're starting to see, specifically in public sector, a real appetite for AI assurance. You don't have to talk about buy-in because, for instance, in healthcare, you guys are pretty mature on it. So is financial services, so is justice emergency services, because you have bioethics, because you have a duty of care, because you have the Hippocratic Oath. And I think that's really kind of helpful for cross-sector learning as well, so bringing along other spaces. And finally, key to the AI assurance ecosystem, and something I think we all need to work on a bit more, we talk a lot about skills. Skills are important. You know, let's talk about the talent pipeline, yes, for technical folk, for founder folk, but also for the human infrastructure that allows us to bring these ethical principles to life. And what I mean is again, AI assurance firms, the responsible AI lead. And so this report really looked at the fact that these people come from very different backgrounds, very interdisciplinary, but they're both a mix of kind of legal, technical, philosophy, ethics, and they're really good at translating across incentive structures and communicating within teams. So hopefully that paints a bit of a picture of like the UK's AI assurance ecosystem, which we are leading in, but also ways that we can kind of build it and create more momentum for it, which I would love.
We'll get to that, right, on how to keep this momentum going. I don't want this conversation to end at this panel. Kanika, again, I mean, you look at, I mean, the WHO will look at this from a slightly more global perspective. We heard from Tess on their work on the AI assurance side, but are there, like, to your mind, examples of policies in other countries that, according to you, show promise or are effective at driving digital health equity? Like, any notable examples? Because you're looking at this from a, you know, a much more global perspective.
I love that question because it also gives me an opportunity to reflect on the work that I'm recently wrapping up. As a part of the Regulatory Considerations Working Group, we have a landscape analysis that we're doing, and we've covered about a population percentage of 95% in terms of country valuations. What we have learned in this process is that there are certain countries, such as the US, where, well, there's US, there's of course the EU AI Act, there are horizontal approaches, there are vertical approaches, there are sectoral-based approaches, and then you'll see in some countries where there are state-based laws, in some countries there are federal laws. What we need is alignment in all of this. What we're learning is that we've made mistakes in past where in different sectors, manufacturers have had troubles with entering new markets. Even though the protocol was quite similar, the taxonomy wasn't, and the compliance mechanisms were quite different. This is what the landscape analysis so far has taught us. There has to be, harmonization is a dangerous word. Alignment is not. There has to be some sort of an alignment between the different laws and policies that different countries have, because by the end of it, we have to remember that AI is cross-border by default, and we have to make sure that there is fairness and trustworthy AI throughout. We cannot risk fragmentation another time, and we cannot have inequities rooting out of AI systems at this time, especially in the health sector, where opportunities are endless.
Thank you so much for that. And I mean, the next theme I wanted